Hello and welcome. I'm Bob Cusack, Editor-in-Chief of The Hill. Thank you for joining us for our program today. After a difficult flu and RSV season that put pressure on healthcare facilities nationwide, the importance of vaccines to help prevent and lower the risk of severe illness once again took center stage. However, a November CDC vaccine confidence report suggests that vaccination rates plummeted during the pandemic and have yet to reach pre-pandemic levels. One of the barriers is cost, something that a provision in the Inflation Reduction Act attempts to rectify by requiring Medicaid and Medicare Part D plans to cover CDC-recommended vaccines. How might the U.S. ensure easy, efficient access to vaccinations, specifically among adults? What barriers do low-income communities continue to face in accessing vaccinations, and how do we address the needs of communities of color to reduce health disparities? We will be putting these questions and more to our panelists today. I'd like to thank our sponsor, Pfizer, for its support of today's discussions. Before we get underway, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag TheHillHealth. To kick off, I'm happy to welcome our excellent panel to help set the scene and provide insights on how to eliminate gaps in vaccine access. And with that, I'd like to welcome Dr. Tochi-Iroki Maliz, a family physician from Long Island, New York, and the president of the American Academy of Family Physicians. Gary Puckren, President and Chief Executive Officer of the National Minority Quality Forum, and Dr. Nundi Selvam, President at IQVIA Government Solutions. IQVIA provides advanced analytics, technology solutions, and clinical research services to a number of life sciences companies, including our sponsor, Pfizer. Okay, let me start off, Tochi, with you. First of all, as I mentioned, the pandemic has had effect across the globe, but specifically, how has it affected vaccination rates across the board?
All right, thank you so much for having me. I'm going to delve into that. I just want to remind our viewers that, again, routine vaccination is very, very important. I want everyone to take away that vaccines are safe, effective, and save lives, and they're the best way to prevent some of the illnesses that are out there. What we've noticed with the pandemic, COVID, according to the CDC, only 20% of adults have 19 and older have received all of the recommended vaccines, and there are about 9 recommended adult vaccines that are required. Perceptions about the vaccine also play a critical role, according to the CDC study released this month amongst adults who are 60 and older. The most commonly reported reasons for not getting the bivalent booster, which is the approved newer booster to cover the newer variants of COVID, was that they felt that they still had a strong protection against the infection, with what they'd gotten before, or they were concerned about the side effects, or they were unsure whether this new bivalent booster was going to be effective. And so investment in vaccine equity, as you mentioned, is necessary to ensure that patients can continue to access the vaccines despite the hesitancy, and access life-saving therapeutics and test to treat. That will help to make sure that our country is prepared for future variants and also to be able to treat our patients equitably.
Gary, and thanks for joining us again. You're a regular at our events. What have you seen that works? And speak a little bit about underserved communities, kind of where we are and where we need to go.
Well, thank you so much, and I appreciate the opportunity to speak with you today. So part of our challenge is when you look across the states, at the data across the states, vaccine rates differ across states. In the state of Florida, for example, we see very poor vaccination rates. Some of it may very well be associated with some of the political climates in that state. And so it's not just it's sort of the information flow that populations are receiving in the communities in which they live. We also see some administrative problems in terms of physicians making sure that they're recommending vaccines to their patients. When we look at the data, what we can see is that in some practices, there's some need for quality improvement in order to make sure that every patient is receiving the vaccine. And then finally, the patients themselves. Again, there's a tremendous amount of disinformation, particularly targeted at underserved and minority populations that discourage them from getting vaccines. And so there's a real need for us to make sure that trusted voices in community, and we do a lot of work, for example, with federally qualified health clinics. Their board are made up of representatives in the community. They're an excellent source to help make sure that certainly those underserved populations and communities get vaccinated. So we have a lot of work to do across the country, but I would certainly call out those states where we see vaccine hesitancy to be more extreme than in other places.
Nandini, jumping off of what Gary said, in different states, there are obviously different vaccination rates. What do you think are the keys to convincing people to get vaccinated? And we're not just talking about COVID-19. We've the flu shot as well as shingles and others. I know somebody who didn't get the shingle shot and then got shingles, and that was a mistake. So what are the keys to success here?
Yeah, I mean, this is a complicated question, but it's not a new one, right? So vaccine hesitancy really has existed sort of since the beginning of the introduction of vaccines. Even if you go back to the 1800s, 17 and 1800s with the initial polio vaccine to what we saw in the 1900s. And really, there was really a period where acceptance was much better before it started to dwindle a little bit around autism and other things. So in terms of vaccines and hesitancy, it's really a continuum. And part of really acknowledging and approving it includes things like looking at financial barriers, right? Like shared decision making, cost sharing. That really has an impact on whether somebody chooses to take a vaccine, if it has an impact on other aspects of their lives. Making sure that the underrepresented, whether it's in their settings and other ways, are appropriately addressed and make sure that we get it out there. So really around financial barriers, we're looking at access to vaccines. So even in states, in certain states, and Gary just mentioned Florida and other places, there may be vaccines, but there may not be in a sufficient number of vaccinators out there to actually get it into arms. And then compressing the timelines around regulatory aspects, right? Making sure that the vaccine is available from when it first gets approved to gets into people's arms. And then the data really suggests that different vaccines have different uptake, and we can talk about that, I think, in a little bit.
Mm-hmm. Tochi, I wanted to ask you about kind of the role of education, because we are living in polarizing times, and what do you think is the best convincing argument on you're seeing on the ground with physicians of convincing people to get vaccinated across the board?
Well, what I do know is that what we're telling physicians and what physicians are doing to do, listening, actively listening, and understanding where the patient is coming from, why they're refusing the vaccine, and addressing that information. So we know that the spread of misinformation on social media and through other channels can affect vaccine confidence. And so using evidence-based science is the key to understanding the necessity and effectiveness of vaccines. Misinformation about COVID vaccine is prevalent and jeopardizes the health of the public. And so our job is to make sure that we stay ahead and stay abreast of the information so that we can share that information with our patients. That trust that's built, especially with the family physicians, and that continuity of care, having your primary care physician or your primary care clinician, whomever you're working with, having that trust factor, because you've dealt with them for a long period of time, you understand, you're trying to give them the best advice that you can based on the information you know and the resources that are available, using that to help correct misinformation, to show them the evidence, and then be persistent, just being persistent, using every single visit as an opportunity to address vaccination issues and to offer vaccination. So the key thing is making sure that our patients know that it's safe, and that if that spread of false information can undermine safety, puts the communities at risk, and potentially leads to patients foregoing treatment. And preventative care is the foundation for creating a healthier community, which impacts the economy of the community and the safety and security of that community as well.
You all have touched upon access and care and specifically cost. You know, when FDA approves something, a lot of people think, okay, then that's the end of the road. But there has to be a reimbursement for it as far as cutting down on equities and making sure everyone can get medicine. Gary, I want to go to you as far as the provision in the Inflation Reduction Act, as I mentioned in the intro. Very important because it mandates vaccine coverage through Medicaid and Medicare. What are you seeing? Are you seeing the effect of that? Obviously, that was a massive bill that had a lot of things in it, but this is an important healthcare provision.
It certainly is an incredibly important healthcare provision. I think it's early yet to see it in the data and the uptake in vaccines as a consequence of the bill. But one of the things I would point out is that prior to the bill, what we saw in the data, particularly in the Medicare population, where these were populations that were insured, but in the case of flu vaccines, what we saw that minority populations, African Americans and Hispanics, were less likely to get appropriate therapy, appropriate vaccines, which is incredible problem because it also translated into higher hospitalization rates, more severity of flu. We see the same problem with pneumococcal. We have a population that is insured, and the vaccine was available, but certainly they were not getting it. So cost is an important part of the equation, but I don't think we should walk away feeling that we've solved the problem just by how we've addressed the cost issue.
Nandini, kind of same question to you, and also where else have you, the United States is very focused on the United States, but is that provision key, and how do we compare with other countries, whether it's on, COVID obviously is getting a lot of attention in China, they're having problems, but what have you seen, talk about that healthcare provision and also kind of models we can follow.
Yeah, I mean, that's an excellent question. I mean, primarily the data we've looked at more recently has been around the US, right, in terms of following through on influenza. So Gary just talked about flu and the disparities when you look at the different age and race ethnicity groups, right? So to be honest, complete transparency, right, as a nation, we have not done very well with vaccines in a long time, even pre-pandemic. So if you look at things like the flu, the 18 plus age group, just within the US, we were at about 44% uptake in around 2017, 2018. And then there was a little bit of a spike during the pandemic, and it's now not quite at pre-pandemic levels, but certainly lower. And then shockingly, we looked at also things like shingles and pneumococcal, which Gary also mentioned. Pneumococcal, I mean, we've seen some improvements, but it's still only at 7.5% uptake if you look at the 50-year plus age group, right? And then the last thing, and I'll get to the international one in just a second, but even in pregnancy, we're seeing that less than 50% of women get the Tdap. So really important markers. So as we talk about what's working really well, what's not working really well, the message really still is that penetration's really low. Certainly we've seen in countries like Denmark, we've seen other nations in Europe where they do a pretty good job of tracking vaccines. But I think a lot goes back to what Tochi and Gary are talking about, really, in terms of how much trust is there in the system? Are we speaking with evidence base, right? Is there a data platform that then weighs in when people make these decisions? Is there confidence in the system? And I think it's not really a one-to-one comparison in all of these places, just because I think as a nation, there's just a lot of information out there and not all of it's accurate, right? But it weighs into people's decisions and getting their vaccines.
Mm-hmm. We do have an audience question. I'm going to just open up to anyone who wants to take it. It's from David Schulke, principal at Health Quality Strategies. What are the state and community-based initiatives answering questions and explaining the risks and benefits that concern many members of the public? Any one of you want to take that one on?
So I know at the National Minority Quality Forum, we've worked a lot with faith-based ministries. Most ministries have a faith-based initiative. We've done a lot with barbershops and beauty salons because we have to engage the patient community. It is not just a provider decision. It's a decision that also has to be made by the individual patient, and they need good information. And so what we try to do is work with those trusted voices. And surprisingly, a barbershop, there's a lot of information gets passed back and forth. And so we try to make sure that those barbershops are well versed with the information and can be a reliable source. And that's really where it has to happen. Communities are different all over the country. There's no one size fits all. And so we have a big job, a big task to do to make sure that each community, and we're diverse, right? I mean, America's an incredibly diverse country. And so every community has their own attitudes and thoughts about and the way in which they accept the information. And so what we try to do is make sure that we're using community voices and supplying them with the information and then letting them translate it to their communities.
Did that surprise you? I'm fascinated by the barbershop angle that when COVID started, obviously we get information from television or our phones. Did you think that at first, that barbershops were going to be so key?
Yeah, in parts of the country, the barbershop is really a community meeting place. People go to the barbershops and almost as a form of getting in touch and staying in touch with the community. I know some of us just like to go get the haircut and get out of there, but some folks actually go to the barbershop, and they become a really reliable source, a way of distributing information. And the same with beauty salons. Women go to the beauty salons, and they pass a lot of information back and forth. So they are a tremendous resource.
Right. And if I can,
Please do,
if I may,
please do.
for the American Academy of Family Physicians, just piggybacking on what you're saying about taking advantage of the community-based resources. With the American Academy of Family Physicians, anytime we have, as we get new evidence, new information, that is shared with the state chapters, and each of the state chapters now shares it with the local chapters within those states. And that's basically arming our physicians, our residents, and our medical students with information that they can share not only with legislators, but also with the communities that they serve, so that whether it's seeing the patient in their office or, participating in health fairs, going to places of worship to share that information, and then of course we have our media ambassadors going out, whether it's on social media, trying to, address the misinformation, share positive messages, giving the correct information, and then also, answering questions on venues like this, trying to share that information, making sure that the communities out there have what they need in order to increase the vaccination rates across the country.
I wanted to ask you a follow-up question because one of my tennis friends is a physician, and he's exhausted. What are just the last couple of years have just been so intense in so many ways. What are physicians saying, and is there a real problem because so many people are overworked?
I think your friend is not alone. The physicians of all specialties are exhausted. It's been a trying few years, especially when you're in the healthcare industry. At times people are happy with you, so at times people are not happy with you, but trying still to do the right thing for our patients. I believe, though, for those of us who are in medicine, we're still pushing forward. We still want to do the best for our communities. We still want to make sure that we advocate for policy solutions, making sure that there's access for our patients to support better integration of primary care, everything that we're doing to make sure that the public health infrastructure is secure. And so we continue to use every opportunity we can to promote vaccinations because we know it's safe, we know it's effective, and so we want to do the best for our communities.
Unfortunately, we've run out of time. I really want to thank our great panelists for discussing this and really educating the public, which is so important. Thank you for joining us. Joining me now is Congressman Brad Wenstrup of Ohio. He, representing Wenstrup, he's a member of the Ways and Means Health Subcommittee, which I used to cover a long time ago, and is co-chair of the GOP Doctors Caucus. Congressman, thanks for joining us. Another regular at our events. Thank you so much.
Yeah, glad to be here. Thanks for having me back.
Well, Congressman, let's first talk a big general question. Ways and Means covers huge issues, including healthcare, trade, and taxes. What do you see on the agenda, and specifically, geared a little bit more towards the healthcare agenda?
Yeah, certainly. And healthcare agenda, I really think that we want to focus on the health of America. A lot of times when you hear the term healthcare, and especially associating it with a political structure of some type like Congress, most people start talking about their coverage and this and that, which is, of course, important. You want to have good access to care. But we're going to focus on more things that have to do with keeping Americans healthy. If you break it, we want to fix it. We don't want to stop that. But at the same time, what can we do to improve the health of America? And I call it health span versus lifespan, right? Even people with chronic diseases that we don't have cures for, how can we keep people as healthy as we possibly can for as long as we possibly can? So the topic today is an important one too, right? And when it comes to vaccines, certainly if you can get a vaccine that prevents you from getting something like polio, for goodness sakes, then it's a whole lot easier to pay for someone who's healthy than paying to treat somebody, especially when something can be prevented. So we're really talking about prevention, but at the same time, advancing cures, advancing new innovations, devices that can help people. And, in some ways too, we have to look at our process. Are we doing things well with the FDA? How important is the CDC to the American people and what the CDC has to say? So wide variety of topics, obviously, but the bottom line is how do we find ourselves able to deliver care, make it accessible, and do as much as we can to keep people healthy and prevent disease and illness?
Are you concerned, Congressman, since the pandemic, basically other vaccination rates have gone down? I remember about 10 years ago, I was very busy. I didn't get the flu shot. I learned that lesson. And since that time, I've always gotten the flu shot, including this year, because not only, and it hurts the healthcare system because it's money out of my pocket, it's money out of healthcare. It's certainly efficient in that way. But are you concerned that not as many people are getting other types of vaccines? And what can you do about it? What's the role of the Doctors Caucus as well?
Well, one of the things that we really want to promote is the doctor-patient relationship. And if you think about a lot of medicine today, the doctor's taken out of it. You're getting a public service announcement or something like that. And we really should be encouraging people to go to their doctor, to discuss vaccines, to be able to check and see what vaccines you have or have not gotten. And I think that's the key. Look, I'm pro-vaccine. I've been vaccinated. I got COVID. And so very much in favor of it, but there needs to be that discussion on all the vaccines with patients, that what the data really is, what the risk people are taking by not getting vaccines, what the risk is to our public health in our communities. And that has to come from a one-on-one conversation, because unfortunately, there's a lot of mistrust out there, right or wrong, whether it's through social media things, whatever the case may be. We really need to have accurate data at the disposal of physicians and do everything we can for patients to get to a doctor, have the conversation about their own personal health. And, we've got the systems that should show, a lot of times people forget. I don't know what vaccines I got as a kid. I don't know if I ever got them. Well, these systems, the BDS, for example, has that in there. That's not something that's government access. That's there for physicians to have access to. And so that can be very helpful, but you got to have that conversation with your doctor. And I think that that's really what we have to encourage. And I think we're all better served when people have the opportunity to be educated on why they need certain things rather than just told they have to get something.
Mm-hmm. We have an audience question, and it's a good one. Megan Wolf, Senior Policy Development Manager, Trust for America's Health, asks, what strategies are being considered and or implemented to ensure access to vaccines for individuals who are homebound?
Yeah, so, we're looking at programs, hospital in your home, things like that, where, you can actually treat people in their home or even considered hospital care. But also, I served on the Rural and Underserved Healthcare Task Force. that we put together, bipartisan event between members on Ways and Means Committee, and we discussed access problems. Now, telehealth won't get you vaccinated, right? But telehealth may be able to identify someone who needs to get vaccinated. And can we deliver programs where it's prescribed by the doctor for the patient to get this and get to them in their home? You know, you're as far as contagious diseases, hopefully you're safe in your home from getting or spreading them. If you are homebound, certainly you want to protect your family as well. But those are the access problems that we need to address if we're going to try and embrace the health of all Americans.
The Inflation Reduction Act, as you remember, was a very partisan debate. But as you know, Congressman, there's a lot of bipartisan things that kind of get thrown into a big bill, and the headlines focus on the fight, of course. There's a provision that we've been talking about that requires vaccination coverage through Medicaid and Medicare Part D. Do you think that's a good idea? And are you seeing that any effect at the local level yet, or is it maybe a little bit too early?
You know, I spent 3 years on our Board of Health, and so public health is personal to me. I don't have a master's in public health, so I'm not claiming that. But I do have experience of treating patients over the years and being a physician who is required to get vaccines to do my job, to be in the hospital, et cetera. So I think that helps increase access. And you know, in that same vein, I look towards insurance companies and I say things to them like, would you ever consider, if you have a patient with a chronic disease like diabetes, would you ever consider allowing them to have 3 visits a year where they don't have a copay? Because too many people are budgeting with their health care, so they don't want to go. But if you have a situation where something is free and that's in the best interest of public health, I think it's a good idea, because if you can prevent something, you save a whole lot more. I think of the cure for hepatitis C, too. We're talking about cures. You know, a lot of people say, well, that's fairly expensive. Yeah, but do you know what it costs for a transplant or for your hospitalizations with your illnesses along the way? So, you know, when we can do cures and prevention, sometimes it's a good idea for us to pay for it, because you'll pay a whole lot more later.
How have you been working on fostering bipartisanship? It's, you know, it still exists today, but it's very polarizing times. There's always a next election around the corner. Has that kind of debate gotten better? Because at times, as you know, it's been pretty nasty.
Well, you know, the bipartisanship you never see on the news. I mean, it doesn't make the news. So people only see the big things where everybody's screaming and yelling, because I guess that's what turns on viewers. So we have our doctors caucus in the House, and we're doctors, dentists, and pharmacists. And on the Democrat side, there's now 4 physicians. And there are several things that individually we have worked on with our counterparts across the aisle, and that we've also done it as a doctors caucus. And just look at the No Surprises Act. The No Surprises Act was really driven by doctors on both sides of the aisle, where we really came together. We wrote the bill. We did it through Ways and Means, but we had tremendous influence in writing that bill, and people were listening to us. I'm on bills with Dr. Raul Ruiz from California. We have the Safe Step Act that deals with formularies limiting how you can treat patients. We have a bill on prior authorization that we passed out of committee on Ways and Means that's bipartisan. And so these issues do get addressed in a bipartisan fashion, especially by those that are in the arena or have been affected by some of the things that end up causing a delay in care or a denial of care. We come together pretty well on that. And I think if we continue to take the approach that we want to advance health in America and maybe steer some of the conversation away from just what your policy is, I think we're going to do a whole lot better.
Last question. As far as House Republican oversight on vaccines and these issues, is this going to be something that's going to get some attention? Because that's a good way also to educate the public.
Absolutely. You know, what I want to know at this point is what has been the real overall effectiveness of vaccines, and really the mRNA vaccine that most Americans have gotten. It's a little bit different than the polio vaccine. In many ways, this vaccine is more of a treatment, if you will, and in many cases a preventive treatment, at least prevention of getting very sick. And that's what we saw from the trials, that even if you've been vaccinated, you can still get COVID but fewer people get it, and people don't get as sick and less likely to be hospitalized. We want to look at the data. We want to look at natural immunity. We want to look at the longevity of the vaccines as far as protecting you. We want to look at the effects of variants of the virus and the differences that happen there, where we've seen this, a new strain comes forward. We've dealt with that with the flu. So we need to really look at data and be holistic in the approach, and again, have good data that we can provide to providers that can sit and talk with their patient about what's best for them.
Last question. I want to get this one in because it's interesting. We're in Washington, D.C. I'm a D.C. insider, but I always like to ask members when they go back home, when you talk to doctors back home, and you mentioned, the No Surprise Act. That was not easy to get through, as you know. But what are you hearing from real physicians who are dealing with patients every day? What's their frustration with Washington?
This kind of goes to one of the things you were talking before I came on, burnout.
Mm-hmm.
The frustration with Washington is you spend more time of your day trying to appease Washington or the insurance company or someone else that never sees your patients, and you spend more trying to appease them just so you can get reimbursed, paid for the work you do, and it really takes away from your time with patients, and it's very frustrating in many ways, and so the burnout becomes greater and greater. A lot of administrative things have been dumped on people, and now, look, when you have cuts to Medicare, you're cutting your reimbursement across the board because most contracts you have with private insurance are Medicare rates plus whatever. And there's only so much you can do and keep your doors open. And that needs to be understood. And I think the doctors today feel that the attitude from Washington is, we're paying you enough already. And so what they take that as, your service, we don't put much value in your service. And the bottom line is, then you start changing the way you practice and what patients you'll see. I don't want to go in to see a patient and worry about whether they're on Medicaid or they have some 100% payment of things. I want to go in and take care of patients and let the other chips fall where they may, but there's too much involvement with trying to please people and often this data has nothing to do with taking care of the patient that's in front of you. And so that's very frustrating. That's very frustrating.
Well, yeah, there's definitely a lot of frustration in the healthcare community toward Washington. Congressman, thanks so much for joining us. Really appreciate it.
My pleasure. Anytime. Thanks.
And now I'd like to welcome Representative Terry Sewell of Alabama. Representative Sewell is part of the Ways and Means Subcommittee on Health, and she also co-chairs the New Democratic Coalition Healthcare Task Force. In 2021, her Maternal Vaccination Act passed the House, which sought to increase vaccination rates among pregnant and postpartum individuals. Congresswoman, thanks for joining us.
Thank you so much.
Let me start with that legislation. That passed the House, if I'm not mistaken, looked it up this morning, by voice vote. Had a number of over 50 co-sponsors. Not many things pass by voice vote, and then it just wasn't acted on in the Senate?
Well, what happened was that it became a part of the Momnibus bill that was wrapped into Build Back Better.
I see.
And Build Back Better, as we know, did not come up for a vote on the Senate side. So we look forward to reintroducing the bill in the 118th Congress. And as you said, it passed with a voice vote, unanimous consent. So we're looking to get on the suspension calendar, this bill in this Congress.
And do you think that now with the House flipping, as you know, it passed unanimously, so do you think that's going to get on the House floor at some point?
I do. I do. We on the Ways and Means Committee, through Republican and Democratic administrations, have sought to get bills that do have bipartisan support on, suspension calendars before. So it's my hope that we will get the Maternal Vaccination Act, which I introduced last year, and get it into this 118th Congress. It's so important. Vaccinations save lives. And the Maternal Vaccination Act really came about because I was really could not believe that so many pregnant women were not getting vaccinated. And but vaccinations obviously save lives. And so it was an effort to acknowledge also that African American women die 3 times more likely than white women in childbirth. And this day and age, when advanced medicine and of course the United States being an industrialized country, so the bill really did get widespread support. It would provide an opportunity funding for a public awareness campaign to promote the materials and to make sure that moms and children got vaccinated and to really increase awareness. It's a big trust issue when it comes to vaccinations, and we saw that so clearly during the beginning of the COVID-19 pandemic. I represent the state of Alabama, more particularly Selma, Montgomery, and Birmingham. But I can tell you that in my district, what loomed large was the Tuskegee Project that, occurred back in the 50s and 40s. But the reality is that government was a bad agent when it came, or a bad actor when it came to giving to experimentation on African American men regarding syphilis, and so that's real. And so getting public awareness about the effectiveness of these vaccinations, especially the ones for adult women who are pregnant and their children, is something that's really, really important.
We have an audience question, and it plays into a couple of issues that you were talking about, certainly identifying them. But this is from Michaela Jackson, Program Director, Prevention Policy, Hepatitis B Foundation. How can we work to ensure more equitable distribution of vaccine funding for all adults, including the uninsured populations?
What a great question. In fact, it's one of the things that I really fight for is equitable distribution of resources and equal access to quality and affordable care on the Ways and Means Committee. And I think one of the ways that we can do that is by being intentional in making sure that public awareness programs and influencers, community influencers, make aware the importance of these vaccinations in uninsured populations as well as in vulnerable communities. And so I think we have to be intentional in our focus on making sure that vaccinations are readily available, especially in low-income, vulnerable communities. And also because I think, these are communicable diseases that really do save lives and would prevent deaths. So I think that I know in the Momnibus Act, we had several bills, especially my bill, that really was about providing an awareness campaign, and specifically in those underserved communities and underserved and uninsured populations. And so, it's about providing evidence-based information and resources on the safety and importance of these vaccinations to public health departments and by public health departments as well as healthcare providers. And so I think that being intentional in that, making sure that the resources that are available, funding that's available for these vaccinations get to these vulnerable communities, uninsured communities, and that we also make sure that the folks who are providing that information are the trusted community leaders.
And how do you mentioned trust, and that's important in any relationship. As far as what kind of works in Alabama that you've seen of getting people to trust policymakers and healthcare experts who say, no, this is good for you. It's going to possibly save your life. What works on the ground?
Great question. What we found is that not so much politicians, but it's the pastors, the first ladies of the churches, the healthcare providers, your daycare center providers, when it comes to sort of maternal vaccinations. But, I think it's really finding those folks in the community that have always been a more trusted validator, if you will, so that you're actually getting your information not just from healthcare providers, but you're hearing about that information while you're at church, having health fairs at the church office, at the church. The church rectory has been a really great way that we were able to boost the numbers for COVID-19 vaccinations in my area. We really did try to partner with those folks in the community that people seem to have great influence on on, on average everyday Americans. So definitely the faith-based organizations were really, really effective influencers for COVID-19, and would be something that I think is important that we make sure that these nonprofits that are actually community-based also receive the resources to get the message out and to do the public awareness about the safety of these vaccinations.
And that's a fascinating answer because, yeah, pastors are more trusted and have higher approval ratings than politicians, as well as the media for that matter.
Of course, we like to think of ourselves, I like to think of myself as a public servant, not
Right.
a politician, but I have to tell you that when I got the shot and it was tweeted out, the first shot, COVID-19 shot, I got a number of folks retweeting it. But when my mother, who was a former librarian at the only public high school in my hometown, oh my God, it shot up exponentially. So it's finding those sort of trusted, leaders, our teachers, our coaches, our, pastors.
We have a new Congress. We've got divided government now, very narrow majority in the House. What is doable on healthcare / vaccine? What do you want Congress to do this year into next on these type of issues, other than passing your bill?
Yeah. Yes, passing my bill for sure. But I also think that we can't underestimate the power of good legislation getting bipartisan support. And I think that my bill is a great example of that. I also carry a bill about multi-cancer screening. There's so many of us that have been affected by cancer that is preventable on the front end if you have screens. And there's so many new technologies that are out there that we want to make sure that the FDA, when they approve them, that we make them available to our seniors, to everyone, especially those in vulnerable communities. And so a good example of sort of bipartisan support, long before COVID-19 hit, I was a part of a bipartisan health task force. It was called the Rural and Underserved Communities Health Task Force within Ways and Means, and it included two Republicans and two Democrats. And the two things that we all agreed on was that we needed better workforce and we needed to encourage that. And the second thing was about telehealth and being able to make sure that's accessible. So when COVID-19 did hit, we were well on our way, to really getting telehealth to be reimbursed. And so that was a natural after COVID-19, but, and during COVID-19, it was really a lifesaver. So that's one example. I know that we also are all concerned about making sure we have, primary doctors, internists in rural communities and underserved communities where there's often a lack of them. And so finding bipartisan support on bills that relate to, access issues, as well as making sure that we have access to quality, affordable healthcare, not just in terms of prescription drugs, but also in terms of vaccinations and in terms of having enough primary doctors in those areas.
I did want to ask you, I know that tornadoes hit Alabama. How is that cleanup effort going with the assistance of the federal government?
Yeah, thank you so much for asking. Yes, my district was hit horribly by the tornadoes of January 12th, and my beloved hometown of Selma, Alabama, had over 6,000 properties that were damaged. It was widespread. People know of my hometown because of the bridge and the march that John Lewis and others took on Bloody Sunday that really brought about the Voting Rights Act. But it's a town of 19,000, and as every graduating class from high school occurs, less and less people stay in my hometown. So really, I can tell you that no truer word it was said than neighbor helping neighbor when it initially happened. I happened to be able to get to Selma the night of the tornado, and I can tell you that we are working as hard as we can and definitely benefited from nonprofits and faith-based organizations and neighbors helping neighbors to get us back up and running. So I thank you so much. And our governor made the request of President Biden, and he issued a disaster declaration within days of it occurring. But it's going to take a long time for those communities to rebuild. And We hope that out of this tragedy comes an opportunity for us to reimagine Selma and those other communities that were affected by the storm, and so that we can really rebuild stronger and better than we were before. So thanks for asking.
Yep, no, neighbors helping neighbors. It's a powerful story, and we've seen it a lot. And good luck with those efforts. And Representative Sewell, thank you so much for joining us today.
Thank you.
For my final guest today, I'm excited to welcome the Administrator for the Centers for Medicare and Medicaid Services, and she can outline some of the steps her agency has taken to increase adult vaccine access. Administrator Chiquita Brooks LaShore, thank you for joining us.
Well, thank you so much for having me, and really just thank you for having this conversation. It is so important and very much on the minds of us here in the federal government as well.
I want to throw you a little bit of a curveball. I used to cover CMS when it was called HCFA, and then it changed to CMS, which is a much better name. But it's such a massive job. It deals with, a lot of people don't know how massive, both on reimbursement and coverage and nursing home. It just goes on and on. You were confirmed in May of 2021. What has surprised you about the job? You've had a lot of experience in other positions, but this one is so intense. I just kind of want you to get your thoughts and reflections on it.
Sure. Well, and I say this every day, it is a privilege to be in this role. And I would say one of the biggest things that is a surprise is I worked at CMS almost a decade ago at the beginning of the Affordable Care Act. And the role that CMS has in our federal health is so much broader than it was then, and then I appreciate it. I mean, we touch everything from, I like to say the 3 M's, Medicare, Medicaid, and CHIP, and marketplace coverage, which of course is how most people in America get their health insurance and get their medicine, et cetera. But it's also things like making sure that facilities are safe, making sure that where you go for your nursing home care, as you mentioned, just so many ways that we influence healthcare in this country. And that not only are we an important payer of healthcare, but we're also critical to the public health world. And that's why, just fitting into the conversation we have around vaccines, we're a crucial part in making sure that Americans across the nation get vaccinated. And we are really, it's a privilege, like I said, to work to make sure we are developing policies, to make sure we are educating people in a way that they take access of the things that are available because of modern medicine.
Well, tell us a little bit about how CMS is working on vaccine access, specifically on vulnerable populations.
It is a huge priority for our administration and certainly our agency. So we've been really working, particularly in the Medicare program, because as we know, so many of the vulnerable people in our country are either over the age of 65 or covered Medicare through disability. And so that's been one huge push for us, particularly to make sure that people know that vaccinations are available. The new drug legislation, the Inflation Reduction Act, adds new benefits. And I will tell you, one of the things that seniors are really excited about is access to the shingles vaccine, which has just become a huge game changer in terms of health, and now is more affordable because that's one of the new provisions that's taken place. So we're doing a lot of work in trying to make sure that we're making that information available, whether it's through social media, through our websites. And just as you were talking to the Congresswoman about trusted partners, that's a language I like to use, that people want to hear from whoever they think of as their trusted partner, whether it's their faith-based organizations, whether it's at the barbershop, whether it's providers, whether it's clinicians, just the whole group. We have really made an effort in this administration to make sure that we develop relationships with trusted partners, keep those relationships, and that they do a lot of our messaging, whether it's on anything like yesterday when we celebrated over 16 million people covered under the Affordable Care Act and now the Inflation Reduction Act, or whether it's about vaccinations, making sure people know how to use the care that they now have access to.
I did want to follow up on that provision mandating coverage, vaccine coverage, in the Inflation Reduction Act. Where are we? You know, the media always kind of focuses on legislation, but then there's a huge implementation. Like the infrastructure bill is going to take literally years to implement. But where are we on that provision? Have you seen any kind of data showing some good things from that important provision and bipartisan provision?
Yes, absolutely. So we're starting to get the word out to seniors because that took place starting this January. So seniors now, people who have Medicare, can get their vaccinations that are recommended by the CDC. They are available to them for free if they have Part D, as in dog, coverage in the Medicare program. There are also provisions around other populations. So if you're an adult covered by Medicaid and CHIP, that coverage for vaccinations starts later in the year, October 1. That's really around adults. For more broadly, if you're covered under the ACA, which means most private insurance plans in this country, you should have access to free preventative services. So certain types of vaccinations that have been approved and recommended to the government are covered free of charge. And for children who are in Medicaid and CHIP, that's been a longstanding provision to make sure that kids can get their vaccinations. We've seen a drop in that, and that's something that we're really concerned about, that fewer children have been getting their vaccinations, their general vaccinations, things like measles, mumps, and rubella, the diseases that were, only our grandparents, are telling our kids about. We've seen a drop in those vaccinations. And so that's another place we're really trying to get the word out.
Right, yeah, and that's really troubling. It's interesting that Mitch McConnell, who survived polio, said he just didn't think that people wouldn't take the vaccines, and so it devolved into this kind of debate. Well, how do we get back to pre-pandemic levels, or maybe even better, as far as the flu shot or other vaccines? This is having this kind of nasty debate has had a ripple effect. What are the, is the role of stakeholders? We talked about barbershops. I know there's no magic bullet, but what's the solution?
Well, I would say I think it's all of the above, but I really do think that there is something to be said for families sharing some of their stories. When I started, just speaking of my own personal life, when I started hearing about polio being an issue, I started talking to my mother about it, and she was telling me about, oh yes, there was this lake near where I grew up, where all of the adults said don't swim in that pond because I guess people had gotten polio. I didn't even know anything about this history. I'd never talked to her about it because polio has never come up in discussion in all of our life because it's just not been relevant. But I think when we remember the stories of our elders, there is some wisdom there of what these things were like. And some of that really needs to be passed down because, measles outbreaks, those types of things are just they're not a part of our story. And so we don't know. And when you think of the 6-year-olds, the 7-year-olds, they don't know. But, we have generations of people who are alive when these things were diseases that we had to worry about. And so I think so much people care about lived experience, and so highlighting those stories and again, that's just one part of it. But I think us making an effort to listen to people who have actually lived through some of these illnesses, who've experienced what it means and what a help vaccination has been for addressing some of these conditions, I think is a real part of what we need to be getting out, both as policymakers, as stakeholders, whatever our role is.
You mentioned nursing homes, and of course, COVID-19 just ravaged nursing homes, and a lot of us, we're in our homes with our family members, but there are a lot of people who can't do that. Where are we? Have you seen progress in the battle against COVID-19 in nursing homes in particular?
We have seen progress over the last 6 weeks or so. The administration has really tried to elevate and push out just how important it is to make sure that people who are in congregate settings, who are among the most vulnerable in our nation, get vaccinated. And so we have seen an increase right now. The best rates in the country are among people who are over 65, and then among the people who are over 65, certainly nursing home residents. But it's still too low. And while, of course, vaccination is not a panacea for everything related to COVID, it is absolutely our best defense against hospitalization and death. And that's one of the things that we have heard consistently, that people respond the most to hearing that the vaccine is the best defense against hospitalization. So we have more work to do at the collective us. We have been working with nursing homes. We've been working with hospitals to try to make sure when people leave the hospital, if they can get vaccinated before they return to the nursing home. To really, as I said, working with trusted partners. We have what we call quality improvement organizations that are available at the cost to the government to try to help facilities to up their rates. This is something that we just are laser focused on trying to really help increase the vaccination rates, mostly really because we want to make sure that people are safe and that they're able to live out their lives in the best way possible.
I know a lot of people have kind of their hand on this. There's a lot of research there, but are we headed for that we're going to need one flu shot a year and one COVID shot? I mean, where do you think we're going to be in 3 to 4 years? I know we're still analyzing data, but where are we headed with just eradicating this, or at least reducing it significantly?
Well, I would leave that answer to the clinicians. I am not one, and so I think that's the role of the CDC. But I think that one of the things that I would say is it's a vaccine, and what we do right now for all vaccines really is there is some sort of cycle where you take them. Some of our vaccines, they're effective for 10 years, and you take them, and some, but I imagine that we'll be taking COVID vaccinations for a long time.
Well, I've enjoyed the discussion. Thank you so much, Administrator, for joining us.
Thank you again. Have a good rest of your day.
Thanks. And that brings us to the end of our program. Thanks again to our sponsor, Pfizer, and to all of you watching. If you missed any of these conversations this afternoon, we'll have video from the event up on our website, thehill.com, shortly. I'm Bob Cusack. Hope you enjoyed the program. Have a great rest of your day.